Hi, Dr. Harrison here, and today I want to talk about neck pain. Neck pain is one of the most common conditions that I see in my office, and in this video I want to discuss the different types of neck pain or sources of neck pain that we see and how we go about treating those. Number one most common type of neck pain we see is just due to tight muscles and restricted mobility. So, of course, we're going to do a thorough history examination on the patient. Once we've ruled out all the dangerous things, usually we'll come down to taking simple x-rays, a front and side view, and if it's just tight muscles and restricted mobility, on that x-ray everything's going to look completely normal. So on the front view everything will be in perfect alignment. We won't see anything rotated or tilted out of its normal position. And on the side view we'll see that the curvature is normal, so they have the proper lordosis in their cervical spine or in their neck. And so that's when we know we're dealing with just tight muscles and restricted mobility. These patients respond very, very quickly to chiropractic adjustments, physiotherapy, muscle stimulation, heat or ice, those types of modalities. Usually anywhere from 3 to 9 visits, they're going to be out of pain and doing well with no ill side effects. So very, very quick fix for those folks. Second most common type of neck problem we see is tight muscles and restricted mobility, but now on the x-ray we also see either the vertebrae either rotated out of its normal position or maybe it's tilted out of its normal position. Well, that's really easy to see on the x-ray because it just won't be standing up straight. Either it's tilted due to one of the vertebrae shifting, or you'll see that it's rotated, or even worse on the side view, maybe we'll see that that normal curvature has been lost. Maybe they've got a reversal of that cervical curvature. And so that's going to be a longer term fix than the first one, because now in addition to restoring normal mobility and getting the muscles to relax, now we've got to try to reposition the bones back to their normal structure. Very important to do that to prevent arthritis from settling in later on down the road. And depending on how long that has been that way, will determine how long it takes to return to its normal position. So that could range anywhere from a few weeks up to a few months or even longer if it's been a real long-standing problem. So we approach those on an individual basis. The third most common thing that we see in relation to neck pain is arthritis. And everybody's heard that term. Well, on the x-ray, usually we'll see that the disc spaces are wearing thin. We might see bone spur formations or calcium deposits. So these are all things that we can see on the x-ray. Usually along with that, we're going to have number 1 and 2, tight muscles, restricted mobility, maybe some rotation or shifting. Many times we'll see that reversal of the curve along with the arthritic change. So arthritis is the third most common thing we see, and it's usually in combination with 1 and 2. The last thing that we typically see would be a disc problem, maybe a disc bulge or a herniation in the cervical spine. These are a little more difficult to fix because that means that the disc has been damaged and probably it's lost its pump mechanism. I discussed the pump mechanism on our spinal decompression video, so I encourage you to go look at that. But I explained that in much more detail there, and I don't want to go into it on this particular video. But just understand that many times these disc bulges or herniations will respond very well to chiropractic adjustment and conservative therapy, muscle stim, ice, ultrasound, those types of modalities. But if they're not responding the way we want them to, then we really need to look at that spinal decompression for a long-term solution. So I hope this has cleared up some information that you may not have understood regarding possible sources of neck pain. If you're suffering with neck pain, or not only neck pain, but maybe numbness or tingling, irritation to the nerves down the arms, usually this is coming from the neck as well, and usually related to that fourth possibility we talked about, disc bulges and herniations, many times will irritate those nerve root problems. But if you're suffering with any of these, please feel free to call the office, schedule a free consultation. We'll find out which one is happening with you. We'll put a treatment plan together to get you back on the right track to health. Or you can log on to our website at Orlando Chiropractic Rehab and schedule an appointment there. I hope to see you in the office soon, and I look forward to working with you.